Good morning, everyone. This is Harshal Desai from Panacea. Welcome you all today on this beautiful Sunday morning. We are back with our expert, and today we are going to have three sessions. We will be starting with a yoga session by our own expert, Ms. Sohini Roy Chaudhary from Sohini Moksh. Welcome, Ms. Roy Chaudhary, to the show again.
Thank you very much, Harshal.
Thank you, Ms. Roy Chaudhary. It is again wonderful to have you on our show. I would like to tell all our viewers today's session on yoga, endocrinology, and neurology are being organized under our program Panacea, which has been conceptualized by eHealth Magazine and Viatris, Narayana Health, Sohini Moksh, and Uttar Pradesh Ayush Society are our partners for this program. Today we are going to start our session with Ms. Sohini Roy Chaudhary, internationally acclaimed yoga teacher, dancer, professor of Natya Shastra. So now, without further delay, we will like to hand over this virtual dais to Ms. Sohini Roy Chaudhary. And after 45 minutes, we will meet you again. I will again appear on the camera. If you have any question, please do ask us. If you have question after the show, please do ask us. We will be more than happy to connect with Ms. Sohini Roy Chaudhary and her organization as well. You can ask the questions live also on our platform. You may please visit our Facebook page, Panacea. You may also visit our website, www.panacea.eletsonline.com. So once again, I welcome all the people who are joining us live for this show, and I would like to hand over this virtual dais to our expert, Ms. Sohini Roy Chaudhary. Over to you, ma'am.
Good morning, India. As we are on the threshold of a new year, 2021, we are aiming towards mental and physical well being so we can inhale our future and exhale the past. Today, we will be focusing on two specific areas of the body, and what I would do with you with our mudras, with our pranayamas, and with asanas would be designed to have an effect on the hypothalamus and the pituitary gland in the body, the two of which control our mental well being. Because, as you know, it's all in the mind. So, these COVID times, some of you have been fighting depression, hypertension, anxiety, and these asanas will help you feel happy, counter depression, counter anxiety, sleep better, and have more energy. We will be starting with the pranayams. As you know, it's very important how you breathe. And oxygen is a natural detox, it's the natural spa within your body. It breathes in oxygen, hope, a better future, and gives out the toxins. It's a natural way of increasing the antioxidant flow in our body. It's the natural way of balancing our fight and flight mode and the relaxation mode of our energy channels. So we will first begin with our breathing exercises, the pranayamas. As I have said before, for the pranayama, you can sit in your Padmasana, the lotus, straight hands in the Jnana Mudra, or you could sit at Sukhasana, which is the more comfortable pose where you cross your legs and sit. And the first breathing exercises that I will do with you today is the Ujjayi Pranayama, the ocean wave pranayama, or the victorious breathing. Here, we will breathe in and breathe out, making a sound by restricting our glottis here, which you can do when you clear your throat. When you clear your throat, there's a constriction here. Hold that constriction and breathe through your diaphragm. So you make a sound. Breathe in deep, and breathe out with a sound. Breathe in, breathe out. We should hold this mudra, the middle finger and the ring finger touching your thumb. This we will come to later what it means. This is the Mrigi Mudra. It helps balances your hypothalamus and pituitary, and hold it like this. Keep it on your knees straight. Fix your gaze, either look at the tip of your nose or look straight on, and we start. Breathe in, breathe out. Breathe in, breathe out. 10 times. Breathe in. Hear the sound of the ocean waves. Let it calm your senses, and exhale your past. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in and breathe out. Hold the Namaste here, the Anjali Mudra, all 5 fingers touching each other and closed. This is honor and respect to ourselves and honor and respect to the other. It is our ancient Indian way of greeting with a lot of energy, with a lot of underlying energy and meaning as we delve into Vedic wisdom. One more thing when you breathe or you do your asanas, which we don't think about, is your drishti, where you look. In dance, we say, Jatho hasta tatho drishti. Wherever your hand goes, your gaze follows. Where your gaze follows, your mind automatically follows. It is very important to look right, to gaze right during yoga. You cannot be in your yoga posture and have wandering eyes. You can't look all over. So you have to fix a point to look at, which is either at the tip of the nose when we are doing all our breathings, or you can look straight ahead at a fixed point, or you can look at your navel when we are doing some of the asanas. Drishti is very important as this is concentrated, focused gaze. It helps calm our mind. It helps to take the body from the adrenaline or the flight or fight posture into the relaxation mode, calms our hypertension, and helps us completely focus and concentrate. Even when you're done with your yoga asanas, whatever work you might be doing, the presentation you may be preparing, or you might be thinking or working, whatever you might be doing, that focus that you started with your drishti during your asana stays put, helps you concentrate better, helps you absorb better, and helps you focus better. Next, we are going to do our alternate breathing. And as I have spoken before, as I have done this before with you, I shall repeat. Your hands are in the Jnana Mudra, that is the thumb and the index fingers pressing together. That is the fire and the air elements. This is fire, Agni, and this is Vayu elements pressing together. One, the left hand on your left knee, right hand, here we go, the thumb out and the ring finger and the pinky out to press upon the nostrils, to release one nostril to breathe in and out, and restrict another nostril. So we breathe in through the alternate channels of our nose. This again has a profound effect on the hypothalamus to activate the sympathetic and the parasympathetic parts of the brain and distribute energy equally in both channels of our body for us to have a more balanced body and a balanced form which creates wellness. We press the thumb on the right nostril. Press it. Breathe in through the left. Deep breath, your drishti is towards the tip of your nose. You're looking at the tip of your nose. So your eyes seem almost closed. Breathe in, then press the left nostril and breathe out through the right. Breathe in through the right and release the left and breathe out. Breathe in through the left. Breathe out through the right. Breathe in through the right. Breathe out through the left. Breathe in through the left. Deep breath. Breathe out through the right. Breathe in through the right. Breathe out through the left. Breathe in through the left. Breathe out through the right. Breathe in through the right. Breathe out through the left. 5 more times. Breathe in. Breathe in your future. And breathe out your past. Breathe in through the right. Breathe out. Breathe in. 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 Breathe out. Last 3 times. Breathe in through the right nostril. Breathe out through the left. Breathe in through the left, out through the right. Breathe in through the right. Breathe out through the left. Breathe in through the left. And breathe out through the right. I'm sure you feel a bit lightheaded with all that oxygen that has gone into the system. The last pranayam that I do would be the forced breathing, which is the Kapalbhati. Breathe in deep, and when you breathe out very forcefully. You can breathe out in intervals of 5, or you can breathe out together. Very important to remember that people suffering from high blood pressure must not do it. If you're pregnant, you must never do it. Neither can you do it after eating something because it causes vomiting. So we will be doing the Kapalbhati. We could do it in the Vajrasana, sitting on our knees, because this also energizes the body and helps digestion, helps metabolism and circulation. So here we go. Breathe in and breathe out. Each time you breathe out, pull in your stomach. Breathe in, expand your stomach. Breathe out. Breathe in, pull in your abdomen when you breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, Breathe out. Breathe in. Breathe out, pull in your stomach. Breathe in. Breathe out. 5 more times. When you do it on your own, you could do it about 30 times a day. That's very good for you. Breathe in. Breathe out. Breathe in. Breathe out. 3 more times. Breathe in. Inhale your future. Exhale throughout your past. Inhale. Exhale. Inhale. Last time. That was your pranayams for today. Next, we are going to do some mudras. The 5 fingers on our hands represent the 5 forces of energy that our bodies are made up of. We are a part of nature, so is our bodies. The fingers represent the Pancha Bhuta. Your thumb is the fire, Agni. Your index finger is air, Vayu. Your middle finger is the Akash, sky. The ring finger is earth or Prithvi. And your little finger is water or Varun. As we do our mudras are gestures or little circles formed by the hand that creates energy and happiness. Creates energy by regulating different chakras of the body and regulating our sympathetic and parasympathetic parts of the brain to control the channels of energy into our body, to activate, to relax and control overall balance. The first mudra that I will start is the Namaste. Once you have done the Namaste, all your fingers are pressing against each other tightly, hand held away from the body, elbows up. Look directly straight ahead. And this is very good for hypertension, for concentration, energy, wandering mind, for children also with attention deficit disorders. This posture, done about 2 minutes a day, has shown very good results. So we hold the Namaste and count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. When we hold the Namaste and spread our fingers like this, spread the fingers out. So again, all the fingers are pressing against each other. The middle finger is folded in and brought together. This is the Asma Mudra. It has a very good effect on the lungs, on your windpipe, which again regulates the oxygen in your body. This is the Asma Mudra. Fingers spread out like this and the middle finger pressed together and held to your body in the Namaste posture. We'll count again. If you can do it for 2 minutes every day, this is supposed to fight allergies, fight asthma attacks, fight general wheezing, and strengthens your lungs. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we have the bronchial mudra. Hold your hands straight. Fold in the middle, the ring finger and the pinky towards the base of your thumb. And bring the middle finger to touch your thumb. Here we go. The bronchial mudra. This, and holding it like this is also called the Vajra mudra, Indra's Vajra. How do we do it? Palm out, the middle finger touching the thumb, the little finger and the ring finger folded into the base of your thumb here, and your index fingers out pointing. Here we hold it and look straight on. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Next, we will go on to the Brahma Mudra. Hold out your hands in a fist, but first your thumb in and then fold in the other fingers, hold them tightly, curl them tightly, and hold them together, knuckle to knuckle. This is the Brahma Mudra. The Brahma Mudra helps your spine health, which really helps your backaches, sciatica. This helps your tailbone, your cervical vertebrae, and overall spine health, which leads to much more energy and general well-being. The internal organs of the body are also protected and helped by this mudra because you're taking care of your spine. Here's the Brahma Mudra. The two fists, thumb inside, fingers folded in, holding knuckle to knuckle. And as we hold the mudra, some people may have knee or hip injury, so you can't sit on the floor. So you could sit on a harder chair or the bed, and you can be doing these mudras even after eating. There's no restriction, or when you're watching TV, or when you're hearing music, or when you kind of waiting for something, waiting at your office or at the airport or the doctor's chamber. These can be done. You don't necessarily have to be sitting on the floor. So here is the Brahma Mudra for your spine health, to reduce backaches or even to prevent them if done 2 minutes a day. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We keep the right hand as it is, the left hand in the Jnana Mudra, and we get the Adi Mudra. We keep this hand as it is, thumbs in, fingers folded in here. Adi Mudra helps us breathe better, helps hypertension, helps anxiety, and helps our cardiovascular tract. We hold the Adi Mudra and count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next, we will go on to the Mrigi Mudra. Here is your finger. Take the index finger, keep it apart. The middle finger and the ring finger touch the thumb. Mrigi as a mriga, the deer. This is the deer posture, the deer mudra. This mudra is very important as it helps the flow of antioxidants in the body. So it increases your resistance, increases your strength, increases immunity, which we all need during the winter times, colder times. It helps resistance towards allergies, it helps resistance towards colds, sore throats, and maintains the temperature of the body. So it maintains against fever and flu. The Mrigi Mudra, the deer, thumb out, middle finger, ring finger, and we hold it tightly, facing each other and away from the body, spine straight up. This is the Mrigi Mudra to help fight hypertension also and for the flow of antioxidants in the body. Next, we will go on to the Mushti Mudra. We have done the Adi Mudra. Now Mushti Mudra, we make a fist, but we make it differently. We fold in our fingers first and then the thumb last on top of all the fingers. And we hold it straight like this. The other hand in the Jnana Mudra, on your left knee, right hand straight like this. This is the Mushti Mudra. The Mushti Mudra helps energize us, helps hypertension, helps anxiety, and has a soothing effect on our bodies to calm down our anxieties. It also helps against diabetes, especially the type 2 diabetes, and controls the flow and the production of cortisols in the body. The cortisols that are produced leads to diabetes kind 2 and also leads to weight gain. And the cortisols are produced in the body when we are anxious and we are tense and we are worrying and we are depressed. This is a mudra to fight against all that towards mental well-being. The last mudra that we do today would be the prana mudra. The prana mudra is the index finger and the middle finger are out, the ring finger and the little finger touching the thumb. This mudra, the prana mudra, is very good in eliminating toxins from the body, looking after spinal health, looking after digestion and metabolism, and very good for allergies. This also calms down the mind, fights anger, fights depression, fights sorrow. As you know, it's all in the mind. And we need a happy mind for a very fit body. So this is the prana mudra. Now that we've done with the mudras, we will go on to the asanas. And today I want to focus on some asanas which all of you can do, or most of you can do. Even children can do it. And we are going to concentrate on the Anahata Chakra, which is the heart chakra. The Anahata Chakra is the heart chakra of the body, and the Vishuddha Chakra, which is the throat chakra. So, this is to fight problems with the endocrine in the body and to keep our heart health very strong. The Anahata Chakra controls and helps the heart expand, controls the cardiovascular system of the body, the flow of oxygen, the flow of blood and circulation generally. And the throat chakra would be for eliminating thyroid diseases, whether it's hyperthyroid or hypothyroid, and controls the hormonal functions of the body, which you know is very important as it's related to almost every function of the body. So first we will start with the posture that is designed to relax the body totally. We can sit in Vajrasan. Vajrasan is the only asana that you can even do on a full stomach after you've eaten, because it really helps digestion, and it is recommended to do Vajrasan for about 2 minutes after each meal, to make sure that you know that your digestive system works well. With the Vajrasan, we will do the backward Namaskar. Here we press our palms together in Namaskar and hold it here and count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Stretch your arms out over your head, Namaskar. In front of you and take it to the back. Here you go, Vajrasan, and 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. We are done. Now we are going to be doing the Paschim Uttana Asana, which is stretching out and touching the soles of your feet. Some of you may not, after stretching out, you may not be able to go down so much. So even if you come up to your knees, it's okay. Each of you have a different capacity. So either you could touch your feet or under your feet or your ankles or bring it up to your knees. This asana, the Paschimuttana asana, also works on the Anahata chakra of the body, but it works on your ovaries, your uterus for women, and for men for their prostate. This is very good for resistance and protection. Stretch out, breathe in, fill in your lungs with oxygen, stretch out completely, and lower your body slowly till you go down. Elongate your spine, hold on to the thumb and put your head on your knees. Count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And stretch out. When you go down, feel your spine getting long. Elongate your spine, stretch your spine and go in. Breathe in, and as you breathe out, go down as much as you can. Elongate your spine. 1, head on your knees. 3, 4, 5, 6, 7, 8, 9, and 10. As I said, each one of you capacity, you can hold on to the bottom of your feet like this and put your head on your knee, or you can clasp onto your feet like this from under and put your heads on your knees. Some of you may not be able to go down so much, so hold on to your ankle and lower your head to your knees, or if you can just stretch up to here, but do as much as you can. Next, we are going to do, since we are talking about the Anahata chakra, the heart chakra, we are going to go on to the Shishu asana. The Shishu asana, as you can see, I am sitting in my Vajrasana posture, which is sitting on my knees, not standing on my knees. And down to a tabletop posture. Stretch your arms, fingers, 5 fingers stretched out so we have a better grip on the floor, on the mat. Stretch, stretch, and then get back to your sitting on your knees. Stretch as much as you can, as much as you can. Put your head on the mat. Drishti, as I said, the concentrated gaze, you're looking at your navel here. It's a Nadi Drishti. You are looking into your navel. Count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Come up to the tabletop. Count 5 and we do it again. 1, 2, 3, 4, 5. Back to the Shishu asana where your arms are stretched, fingers stretched out, spread out, and firmly gripping the floor, and then we sit on our knees. Press the hands to the floor as much as you can. Rest your forehead on the floor. Drishti, your eyes, the gaze is towards the navel. And 1, 2, 3, 4, 5, 6, 7, 8, and 9, and 10. Come up. This, as I said, opens up the channels of your heart, and this is very good for people who suffer from hypertension. It relaxes your entire body and mind, stretches you out, and helps circulation. The next one that we do is the puppy posture or the Uttana Shishu asana. It's an evolved form of what we just did, and that is known for guarding heart health and working on the Anahata chakra, the Vishuddha chakra, the throat chakra, the heart chakra, and the Mula chakra, which is the root chakra, which is for the overall well-being of the body. So here we are in the tabletop posture again, and what we do is we stretch out our arms even more, and then we will sit down and come down, but we are standing on our knees. So this is what we do. And put your chin on the mat. This is the puppy posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Get up to your tabletop again. This is the rest posture of this. Count 5. 1, 2, 3, 4, 5. And we get back into the puppy posture. Stretch your arms, fingers spread out to press on the mat, to have a firm grip, and lower your body so that the chin rests on the floor mat, but you're in a knee stand posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. This should definitely help. This asana is not so difficult. You have to practice doing it. But it is one of the most beneficial asanas that there are, because it helps your 3 chakras at the same time, the Vishuddha chakra, the throat chakra, and everything that goes with it. It's the place where all the hormones of the body are regulated. It works on the Anahata chakra, the heart space. It is the heart chakra, which really helps expand the heart, better circulation, and protects heart health. And the Mula chakra, the root chakra, which is the root of all of it. Next, we are going to go to the downward dog, or the Adhomukha Svanasana, and it is also called the perfect V. It stretches the entire body and also works on our heart and our throat, among other parts of the body. We get into the tabletop posture again. Here we are. And then we will get up. See, your knees and legs will be at a distance of your hips. They are not joined together. See, here we are, the gap of a hip. We get up, bringing the head down, and we do, if you are uncomfortable putting your entire feet on the mat, you can keep the heels off the ground a bit for better balance, and push your head as much as you can. The drishti is the navel. You're staring at your navel. This is the V, or the downward dog, the Adhomukha Svanasana, and count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Come back to the tabletop and count 5, 1, 2, 3, 4, and 5. Once again, bring your body up. The hips should be, bring up the body so that the hips, the sitting muscles point to the ceiling. Here we go. If you can't put your feet on the mat flat, if it hurts, put up the heels a bit away from the floor. Put your head, push it between your hands. Eyes drishti towards the navel, and count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. This will also help your hamstrings, to open up your hips, to help your shoulders, and your entire body along with your spine. Next, we are going to go to the cow and the cat posture, which we touched up in the last lesson. It's the Bitilasana and the Manjari Asana. That is to take care of your spine. As you know, the spine being taken care of, the internal organs of the body are protected, and overall better health. So for that, we will do one after the other, alternate, so it is maximum effective. So here we are in our tabletop posture. For the cow, we will inhale. Inhale for the cow and remove your spine, bring out your spine towards the ceiling and your chin pressed against your chest. For the cat, exhale and try and bring your spine to the navel and your head up. Cow, Vitilasana. Inhale. And Manjari Asana, exhale. Inhale to the cow. And exhale. Inhale. And exhale. Look up for the cat to a straight point ahead for the drishti. And when you inhale, press your chin to your chest and let your spine round up. Spine should round up and move away from the navel. Exhale. Bring the spine near the navel and look up. Last time, Vitilasana, inhale. And Manjari Asana, exhale. Cat and cow. One more time. For children also, get to the cow, inhale. And get to the cat. The cat stretch, exhale. If you have any questions, you can ask me. Before that, we will do a bit of the Bhujangasana, the cobra, which is in symmetry with these asanas that we are doing today, tailored for your Anahata chakra, and it helps open up your heart, open up the core of your wellness and your throat, the Vishuddha chakra. So for Bhujangasana, which is also known as the cobra, first you go down, join up your feet, don't keep your feet apart, hands by the sides, bring your hand so that the palm are next to your shoulder blades, fingers together, grip the floor well and bring up your body up to your navel like a backward stretch almost. Feel the stretch. This is very good and almost sometimes an instant cure for backaches or sciatica. Backaches, if you suddenly hurt your back and you do this asana 5 times, 30 seconds to 20 seconds each time, you feel instant relief. Here you will stare. The drishti is a fixed point on the wall or any space in front of you. If you are doing your yoga asanas outdoors, imagine a point in space, one fixed point and stare at that. 1, 2, 3, 4, 5, 6, 7, 8, 9, and go down slowly, head by the side, hands by the side. 1, 2, 3, 4, and 5. Bring your hands close to the body and your palm should be next to your shoulders. Grip the floor well with your hands and lift up your upper body up to the navel, should be above the mat. Look straight at a fixed point. Stretch your back as much as you can. It's almost like a back bend. And count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Lower yourself slow. Put your head by the side, hands by the side, count 5. 1, 2, 3, 4, and 5. Raise yourself, turn yourself to the side, and then raise yourself so the body doesn't get a shock. I think that would be all for today. We're running out of time. If you have any questions, I would be happy to answer it for you.
Thank you so much, Ms. Roy Chaudhary, for this wonderful session on various yoga mudras. There is only one question that we'd like to ask you. Someone has asked in Facebook comments. Uh, it should be whether it's not a question, comment in fact, that we should be very careful while doing the breathing exercises, right? Especially Kapal Bharti. So, would you like to say something on this?
Yes, as I have said, Kapal Bhati must never be done by pregnant women. In an advanced stage of pregnancy or the initial stages of pregnancy. Must not be done with people with high pressure and never done after food. I mean, after food, it will cause vomiting. But pregnant women will have to be super careful not to do it. And people suffering from hypertension must never do it with
Right.
Kapalabhati.
Right. Thank you so much. And besides this question, we have received some positive comments in our Facebook section. So thank you so much, Ms. Roy Chaudhary. And we would like to end this session today, this Sunday, on yoga. And on behalf of entire Panacea team, we would like to thank you, Ms. Sohini Roy Chaudhary from Sohini Moksh, for again appearing on this platform. Coming here and instructing the audience who has joined us from across the country. We have about 1,500 people live on this session right now. So thank you so much. I believe our next expert, Dr. Shrikant from Narayana Health, is there already. May I request my team to please bring him on the camera? Well,
Good morning.
yeah, good morning, Dr. Shrikant. Thank you so much for joining us. So, Dr. Shrikant Venkat Krishnan has joined us from Narayana Health. And Dr. Shrikant, for your knowledge, we just have finished a session on yoga. Yours is the second session today. And Dr. Shrikant is neurological in the field of neurological rehabilitation. He is consultant rehabilitation medicine Narayana Health, who is going to conduct this session for next 45 minutes. I would again like to request the audience, if you have any question, please do ask us. You can leave your question in comment box in Facebook. Dr. Shrikant, we have about 1,500 people live with us at this moment, and who will be listening to you and probably asking questions also towards the end of this session after 40 or 45 minutes. So I would like to now hand over this virtual dais to you, Dr. Shrikant.
Good morning. Are you able to hear and see the presentation as well?
Yes, we have the presentation, COVID-19 Neuro.
Right. And are you able to see me as well?
Yes, sir. We are able to hear you also.
All right. So Good morning, everybody. I've already been introduced. Thank you for this opportunity to share some of the experiences that we have had in treating COVID-19 patients. I am a consultant in neurological rehabilitation at Narayana Health in Bangalore, and my department helps people and patients with difficulties in doing the day-to-day tasks, secondary to neurological, cardiopulmonary, as well as musculoskeletal issues. So we have a multidisciplinary team who helps patients with severe disease, and we help in transitioning of care from the acute care units such as the ICU and high dependency units down to the wards. We take the family and the patient together in all our interventions and try to discharge them by setting certain functional goals which will reduce burden on caregivers and increase independence for patients. So, as we all know, COVID 19 has wreaked a lot of damage and changed a lot of things, not only in the society, but it also affects a lot of organ systems within the body. So, it's not, as Trump would claim, that it's a flu, it also involves other systems apart from the respiratory system. So, when it involves the lungs, it primarily causes restrictive lung failure and lung tissue damage, which leads to residual cough, impaired exercise capacity, desaturation on physical activity, and difficulty in breathing, sometimes even at rest, which would place a high dependence on oxygen. And initially, some patients also need to be ventilated. Uh, when it involves the brain and the nervous system, it can cause strokes, cognitive impairment, neurobehavioral issues, neuropathies, and focal neurological damage, and diffuse brain damage. It could also cause damage to the heart muscle and the electrical conduction systems, leading to irregularities in heart rhythm, and could also lead to heart failure in some cases. And when it involves the musculoskeletal system, it manifests as joint pains, aches, and fatigue. So, what we have commonly seen while treating patients is that a lot of them present with strokes. So, COVID predisposes people with or without comorbidities for increased clotting of the blood vessels. This could lead to either a clot directly within the brain blood vessels or a cardioembolic stroke, where the clot travels from the heart to the blood vessels of the brain, leading to a focal impairment of brain function. It could also cause critical illness neuropathy. We have seen a lot of patients require ICU care in COVID, and they require to be ventilated. They're on a lot of antibiotics, and there are secondary infections. So, in such long-term ICU stay cases, we tend to see that there can be diffuse nerve damage, which leads to residual weakness, breathing impairment, and difficulty in weaning off ventilation. And we've also seen a lot of cases where there is damage to a focal nerve, a specific nerve. And we've seen that happening in the sciatic nerve, which supplies the foot, and the peroneal nerve, sometimes the radial nerve as well, which supplies the hand. So there can be focal involvement where the disability is not as much when there is diffuse neuropathy. We can also have myopathies where there is inflammation of the muscles and causing weakness and muscle wasting and focal muscle tenderness. And also encephalitis, where there can be inflammation to the brain and its blood vessels, which causes diffuse involvement. As a result of all these probable diagnoses, what we tend to do as rehab professionals is we try to classify their deficits as impairments, and each disease has specific impairments. Where in stroke they can have weakness of one side, which can later there can be tightness of specific muscle groups. They can have cognitive and communication issues. Swallow might be affected, and because of immobility, they might have secondary complications such as a pressure ulcer. Because of inability to clear out respiratory secretions well, they might need a tube called a tracheostomy tube to clear out the secretions. And patients with neuropathies tend to present with weakness, pain in relation to the nerve distribution, sensory loss, and easy fatigability, which is similar with myopathies, except that they may not have sensory loss. And in encephalitis, there can be confusion, an altered sense of arousal and awareness, weakness, involuntary movement disorders, and neurobehavioral issues. And as a result of all these impairments, they have functional limitations, such as difficulty in carrying out day-to-day tasks. They might have problems in getting up from bed, changing their position. They might have problems with walking and self-care, such as grooming and brushing. Because the swallow might be impaired, they might need a Ryle's tube, so they need to be fed through that, and problems with toileting and bladder and bowel issues. So we tend to classify first the biological impairments and then see what functional impairments arise as a result of these. There are scores that we use to quantify how much the impairment is, and based on which aspect is involved, we focus our care to that area. So this is in an acute care setting, and when there are no resource limitations, we use a multidisciplinary approach where it's not only the doctor and the nurse who's involved, but a lot of other professionals come into play. And you have doctors who could be pulmonologists, neurologists, cardiologists who take, and endocrinologists who take care of the comorbidities. And the rehab professional helps to manage these medical issues in the context of physical function. The nurse is paramount in the care of somebody with severe disability, because they will need frequent position change, administration of medications, management of all the lines. And you have therapists who include the physical therapists who take care of physical function, and occupational therapists who take care of day-to-day tasks. The speech therapist takes care of communication and swallow. And you have the dietitian, because COVID causes severe muscle wasting and generalized debility. You need to have a tailored high protein diet and optimize the dietary requirements. And importantly, we since there is a lot of burden placed on the family, and sometimes family may not be able to see them because such patients are transitioned from the COVID care unit to the wards. We also need the involvement of a social worker who helps identify specific domestic issues and liaise with the family. So, in the context of COVID, also what we need to remember is that it's not only the neurological system that is involved, but also a lot of these patients who have severe disease might need oxygen support as well. So, what we have found is that they tend to stay in the hospital longer and require more intensive care to transition them from the acute care to the community. So I'll just give you a breakdown of what are some of the things that we can do um, in each of these impairments. So in the case of stroke, these are some of the impairments that they can have. And for swallow, the speech and swallow pathologist would work on um, uh, identifying the correct semi-solid texture of food that the patient is able to swallow, work on passive swallowing exercises, and increase the oral intake in a graded fashion. Gradually, we would then take inputs from the therapist to see if we can reduce the Ryle's tube or the feeding tube intake, and then train the caregivers on how to feed patients appropriately. They might require, if you have dysphagia to liquids, you might require a chin tuck and double swallow to safely swallow. And feeds need to always be given in the upright position, otherwise there is a tendency to reflux. And this needs to be done very carefully. A speech therapist would also work on exercises, oromotor exercises for communication and breath control. In case there is a left-sided stroke, they can tend to have aphasia, where they are unable to understand simple instructions and also communicate. So we would then instruct the family to speak to the patient in slow, clear sentences, identify consistent yes or no responses, look at non-verbal ways of communication, and then if speech is difficult even then, we would look at augmentative assisted communication, where we can use signboards or apps, mobile apps, to help with communication. And a neuropsychologist would also be involved in identifying the extent of the cognitive impairment and administering specific therapies for that. When it comes, a lot of these patients, because of their dysphagia and the motor weakness, they can also have a very bad chest, which requires, sometimes they might be on a tracheostomy, as I said, and these patients require intensive chest physiotherapy to help mobilize the secretions from the lung and frequent care of the tracheostomy tube and suctioning. And gradually, as their swallow improves, the oxygen requirement reduces, and they're able to cough on their own, we would think of weaning them off of the tracheostomy tube. And then, and this process would take anywhere between weeks to a few months. And once the patient is gradually getting better, parallelly, we would be working on improving their bed mobility, improving the joint, maintaining joint flexibility, and preventing contractures or stiffness of the joints. And the physiotherapists and the occupational therapists have a great role in this. So the physiotherapists take part in help in strengthening, maintaining joint range, making sure that the patient sits for adequate time. So while in the hospital, it's essential that they don't remain in the bed all the time. They need to be sitting at least for 4 to 6 hours to be able to start standing and ambulating. So physiotherapists play a great role in that. And the occupational therapist helps out with bed mobility and activities of daily living. So in addition, such patients can also develop certain focal tightness for which injections and medications can be given. So we call this spasticity. And we tend to avoid medications because they can have certain side effects such as drowsiness. And based on how they improve with therapy, we add these interventions as and when required. People with diffuse and focal neuropathy tend to have weakness and pain. So pain is managed with physical modalities such as heat or electrical nerve stimulation, and medications are titrated according to their response. We would also help with certain coping techniques such as breathing and shading, which tend to work on mindfulness techniques to help with their pain. And the therapist would help with strength and balance training. And if required, such patients might also benefit from splints such as an ankle foot orthosis or assistive devices such as canes and walkers. So we see that physio has a very distinct role in that they work on joint mobility, flexibility, strengthening, pain management with modalities, and also they help with ambulation and transitioning from a wheelchair-bound state to walking. An occupational therapist is a rare group of professionals. They are present in a few centers in tertiary, in bigger cities. So, and they're not present in many hospitals. So hospitals which have them are pretty lucky. And they work with activities of daily living. They start off with grooming and feeding, help them to manage their clothes, balance training, make sure that they don't fall, and also they help with fine motor tasks such as even writing, and that will come in the later stages of rehabilitation. And as and when required, we need the services of an orthotist to help with splint making and providing assistive devices such as a walker or gait aids such as canes. So there are other professionals such as speech and language therapists and neuropsychologists who I said help with swallow, language, and communication issues. There is also a subset of patients who have long COVID, in that initially they might have had mild or asymptomatic COVID, and then later on they develop, or symptomatic COVID and later develop residual symptoms. It take a long time in recovery, and it might take anywhere between weeks to months. And generally, they tend to present with fatigue, cough, desaturation during exercises, residual diffuse pain, and muscle wasting. And for these patients, we prescribe an individualized exercise program where we need to take care of the fact that they might desaturate, or oxygen levels might drop with physical activity. So we monitor their symptoms and oxygen saturation while they're doing certain tasks. We use certain tests such as the sit to stand test. If your oxygen saturation does not drop by 3 to 5 points on sit to stand about 10 times, then we proceed to a more strenuous exercise program. We also use the 6-minute walk test and 40 feet walk test. And based on the performance in these tests, we prescribe certain aerobic conditioning exercises, breathing exercises, and strengthening exercises, which would help the overall mobility. And at each follow-up visit, we would make sure that there is a graded increase based on their symptoms and oxygenation. And it's very important to do it in a stage graded manner. And we also suggest that during for their day-to-day tasks, the patients pace their activities. Sometimes they may not be able to do things that they were earlier able to do at one stretch. So you might have to walk, take frequent breaks while walking. Even in the home, it's important to have chairs spaced about such that if you're not able to walk from the living room to the bathroom, you take a small break and then proceed. And one can also use energy conservation techniques and pacing, such as paced breathing, where if you're climbing stairs, you can climb by inspiring once while taking one step and expiring for 2 steps. So these techniques help patients with long COVID. And generally, patients with long COVID may need follow-up either through teleconsult or an outpatient basis. And for all these patients with neurological involvement, initially rehab starts off in the inpatient setting, proceeds to the outpatient center, and these days the government has also made tele-rehab or telemedicine legal, and a lot of patients are availing services in this manner. So if you're interested in looking at what activities you can do, these are some of the links which I can post in the comment section later as well, which give a nice set of exercises which can be done at home. But you need to keep in mind that you need to first make sure that you don't have any increased tiredness or breathlessness while doing these tasks, and contact either your doctor or your therapist before you start off any of these exercises. For patients who are initially starting off with their rehab, they need to and they don't have access to a healthcare facility. They need to have a pulse oximeter so that the exercise is titrated according to their oxygen saturation. So these sites give a good sort of flow of what activities can be done. And so what COVID has affected a lot of organ systems, and we see that the patients need between weeks to months to recover, and a comprehensive combined team effort helps a long way in ameliorating their symptoms. So thank you for your time. So if you have any questions, I'll be happy to answer them for you.
Thank you so much, Dr. Shrikant V, consultant rehabilitation medicine, Narayana Health. Thank you so much for this session. Of course, we have got a few questions on WhatsApp and in Facebook comment. So, would like to explain these questions in detail. Someone has asked how important is the balance of electrolytes in our bodies.
So it's electrolyte imbalance can cause a lot of symptoms such as drowsiness and heart conduction abnormalities. So if you have found that during any phase of your hospitalization or on routine tests, um, there are certain normal lab values. It's important to get another set of tests because the electrolyte values indicate a balance of different hormonal systems, such as the thyroid and cortisol balance. And if you tend to have electrolyte abnormalities, it could point to some other involvement as well. In addition, having low or high electrolytes can also cause symptoms in the elderly, such as drowsiness. And one must not also look to correct it aggressively, because that can also lead to complications. So it's important that if you've identified an electrolyte issue, you need to take note of it and get a few tests done, see an endocrinologist who or a general medicine specialist who will then evaluate it further to see if there are other issues happening as well.
Right. Have you seen these kind of issues in the patients that you are probably treating suffering from COVID-19?
Not specifically with COVID, but they tend to have a lot of the patients who are admitted with COVID also have a lot of comorbidities, such as
Uh-huh.
diabetes and hypertension. And in the connection of secondary infections such as sepsis, there can also be a lot of electrolyte imbalance. So, and that can carry on into the outpatient care as well. So, as long as it is stable, these patients can be discharged, but requires further evaluation during the inpatient care. Commonly, we see hyponatremia, which is a low sodium, and and that causes drowsiness. In patients with renal failure with COVID, we see increased potassium, and because a lot of them have swallow impairments, they don't have a regular diet, oral diet, and they may be on tube feeds. So this can also cause sodium and potassium impairments.
Right.
And sometimes in those who are in the OPD, you can have, if you're feeling a lot of cramp. COVID can also cause fatigue and cramping. So it's important to get your calcium and magnesium levels tested as well.
Okay. Has it anything to do with the diet? Do you suggest anything for such patients?
Well, that depends on their electrolyte levels. So, if you have a low sodium, in addition to medications, you could also add a little bit of salt. But again, it needs to be done in consultation with your doctor. It needs to be balanced out with your hypertension. If they have hypertension, you can't add too much salt into your
Right.
diet.
Right.
If you have low potassium, you could be supplemented with fruits and having a healthy, balanced diet with fruits and vegetables and
Mhm.
grains and millets. Millet also tends to help. Ragi is a very good source of calcium. So, and having a balanced diet is very important to maintain your electrolyte levels. But
Right.
if somebody tends to have these symptoms, a routine test would reveal these issues.
Right. Right. Thank you. Thank you so much, Dr. Shika. Next question we would like to ask you is again, this is someone has WhatsApped it to us through our Facebook page. How COVID-19 has affected issues pertaining to Parkinson's and Alzheimer's during the pandemic.
So that has caused a lot of patients with Parkinson's and Alzheimer's. The first thing that has happened is that they have not had access to their neurologists, and
Hmm.
for several months together, they might have been lost to follow up. You cannot, even though telemedicine has helped to some extent, um, it's difficult to really see fine changes in the gait or behavioral issues without a physical visit. And this has, in the initial part of the pandemic, it has, in the first 2 to 3 months, hospital follow-up was poor. And in addition, patients with Parkinson's and Alzheimer's also can have other comorbidities. So management of that has also become an issue. Physical activity is very important in preventing physical and cognitive decline. Because of these lockdowns, it was difficult for patients to get their daily exercise and such as going out for walks. All those things became really difficult. So and a lot of that still exists because there's a lot of stigma and issues with going out for walks and getting physical activity. So it's really important to have a basic um sort of exercise program and use teleconsult services with your neurologists or your primary professionals as much as possible, not to stay, say that, okay, COVID has done this, we will just stay at home. That's going to might cause further worsening of symptoms. So it's important to stay in follow up, and also get some exercise in this phase. And while I say that, it's also important to follow the routine precautions of um, wearing a mask if you're going out, and following hand hygiene and maintaining physical distance. So it has been difficult, yes, in terms of follow up. But in terms of COVID actually affecting the disease progression of Parkinson's, there's not much evidence, or Alzheimer's, there's not much evidence to suggest that it has. But indirectly, it has caused these um, problems due to societal restrictions and fear.
Right. Many people have joined us actually for the next session, which is on endocrinology. However, for them who have just recently joined us, would like to ask this question to you again. However, you have spoken about it. That what are the general post-COVID, neuro problems patients are facing that you are witnessing?
So a lot of our patients have been afflicted with strokes, because there's a tendency for the blood in the vessels to clot. There can be diffuse neuropathy. There can be focal neuropathy, such as foot drop caused by a sciatic nerve damage or peroneal nerve damage, so it's nerves of the foot. And there can also be some involvement of the hand nerves as well. Um, in some cases, we have seen encephalitis or brain inflammation, where there is confusion, movement disorders, neurobehavioral issues. Rarely it has affected the spinal cord, but these are the general common manifestations of neurocovid.
Right. Thank you so much. Thank you so much, sir, for all this. I would like to tell the audience that if you have got some questions, and if you are watching this video, if you're not watching us live and you're joining us again, let's say probably afternoon or evening today or tomorrow, even then, if you have any question, please write to us. You can connect with us. You can visit our website, panacea.iletsonline.com. If you have a direct question with Mr. Dr. Srikanth, we would be more than happy to connect with him, you all with him directly. You can ask your question on this public platform also. And thank you so much, Dr. Srikanth, for this session. So we would like to close this session now here, the live session. We have one more experts joining us from Narayana Health, and I will be getting ready for the next session now. So thank you so much, Dr. Srikanth, and we would be connecting you with other people if they have got questions for you.
Thank you for this opportunity. Thanks a lot.
Thank you, sir. Thank you so much. May I please request my team? I believe our next expert has joined us, Dr. Kranti Khadilkar. So she has joined us. She is consultant endocrinology, Narayana Health, Bangalore. Welcome, Dr. Kranti.
Yeah, good morning. Am I audible?
Yes, you are audible. You're audible.
Yeah,
So
sure.
we just had two sessions on yoga and neurology. One of your colleague, Dr. Shrikant Venkat Krishnan, was with us recently for a session on neurology, and would like to tell you that you're appearing on this program for the first time. So Panacea is a 6-month-long campaign started in the month of November, with the support from Viatris, one of the very prominent pharma organization in the world, Mylan Pharmaceutical, which is a Viatris company now, and eHealth magazine, which is a monthly magazine which covers the entire ecosystem of healthcare sector in the country. eHealth organizes a lot of conferences and events in the healthcare domain across the country. We were organizing many events physically, and now we are organizing this event virtually. So eHealth and Viatris has come together, join hands to design a program called Panacea, where we are through various online sessions, about 10 of them in a month, we are assisting people who have probably suffering from COVID are in isolation, or they have recovered from COVID-19 but still not able to cope up with its after effect. So this is just an effort from us to help such people across the country. Right now, about 1,200 people are joining us live, and we usually are get connected with thousands, more than 20,000 people in a day through our platform. So now, without much delay, I would like to hand over this virtual dais and virtual mic to you for the next 40 or 45 minutes. And towards the end, if you have any question, we would be asking those to you. So over to you, Dr. Kranti now.
Yeah, so I can share my screen. I'll do that. At the foremost, I'm honored to be a part of this initiative, and I feel this is very important. As a doctor, we do the treatment, but we generally don't look at the after effects after the patient goes home. So this initiative, I feel, I guess, is the first in this country, and it will go a long way in integrating the community as well as the medical professionals. Generally, the
Right,
community complains that the medical professionals seem to be distant and not in tune with what are their needs. So here we can actually have the unmet needs listened to and heard.
right.
I'm honored to be a part of this platform. I'll just start sharing my screen.
Sure.
Just a minute.
You can see the share screen
Yeah,
button.
just a minute. Huh? I'm just opening the PowerPoint.
Yes, yes, yes. Meanwhile, would like to tell the viewers that Dr. Kranti Shirish Kadirkar, she is consultant endocrinology, Narayana Health, Bengaluru. She was earlier working with KM Hospital in Mumbai, and she is going to conduct this session on endocrinology today at this Panacea program. Yes,
Yes. Is my slide visible?
the slide is visible, but I think some part of this is being not visible. COVID-19 impact of endocrino.
Oh,
That's what you can
okay.
see.
Okay,
Now,
I'll just 1 minute.
yes,
I'll just try to reduce the size and then we can see if it
right.
is completely visible.
No, not yet, ma'am.
It's cut, is it?
Yes.
Okay. Uh,
I think you can keep it like this also if you want.
Yeah, sure. More
Yes,
impact would be on the talking part. Fine. If
yes,
any
yes.
points anywhere in between not visible, you can just tell me in between itself. I don't have an issue. So
Sure,
let's
sure.
begin. So I have already been
So,
introduced, but I'll
so
introduce myself. So I am Dr. Kranti Khadilkar. I'm a consultant endocrinologist at Narayana Health City, Bangalore. And I would be talking about COVID-19 and impact on endocrinology. So, disclaimer at the beginning, I am not a COVID specialist or an infectious disease expert. I am an endocrinologist. So, basically, a specialist who deals with hormones, diabetes, thyroid, and the other hormones. So there is no need to introduce what COVID-19 is. I guess even a 1 year old will start speaking in the first word as COVID these days. So coronavirus disease or COVID-19 has rapidly emerged as a global pandemic, and it is requiring unprecedented measures at almost all levels. It's like a third world war which is happening. The only good thing in this war is that all the countries are together in this. So, why COVID-19 is different from other viral infections? The main issue is it has a predilection for multi-organ involvement. So, the COVID-19 virus particles, they enter the body through the respiratory tract, and they attach to receptor, or we call in layman's term as an area of affiliction. They like a station, so they go and sit on the station called as ACE2 receptors. So these receptors are present in multiple cells of the body. That's why COVID-19, though it is a respiratory tract virus, it affects almost all the organ systems, right from the brain to the cardiac system as well as to the endocrine system. So that is what is making it a more dangerous viral disease, because it has a multi-organ involvement. So, just a brief introduction to what is endocrine systems. So, endocrine systems are basically different glands which secrete different hormones. So, we have the main queen gland or the controller gland, which is the pituitary gland. It is in the brain. And then we have certain other important glands, some of which you might have heard of, which is thyroid, very commonly known to a lot of people. Pancreas, it is near the near the stomach, and it secretes important hormone called insulin. Then ovaries are the female reproductive glands, and the testicles are the male reproductive glands. You may not know what adrenal is. Adrenal is a very small gland sitting on top like a cap over the kidney. It has a very important function of helping us during our stresses. So it secretes adrenaline, which is the stress or the hormone, and the cortisol, which is again a steroid hormone, very important for survival. So this is basically the endocrine system, and we would like to see in detail what is the impact of COVID-19 on all of these systems. So, what would be the mechanism of interaction? How the endocrine glands are affected by COVID? So, as in other organ systems, COVID-19 virus either destroys the gland directly by entering it directly into the gland and destroying it by the viral infection. But the major problem with COVID is the virus itself doesn't cause much harm, but it basically targets or activates our immune system. Immune system is the system which helps us to fight infections. So the immune system starts getting activated, but it gets activated to such an extent that it results in what is called as a cytokine storm, and which ultimately becomes detrimental to us. It is like, you can imagine, our army is activated by some infiltrators, but the army has become so activated that it has stopped understanding who are the infiltrators and who are the citizens of the country. So that would be the example that what happens in the COVID-19 infection. The immune system becomes so activated that it gets antagonistic to our own cells, and that creates major havoc, or more havoc than the direct viral infection itself. So this is a bit tedious to understand, but I will explain in short. So this is our COVID-19. So this is what is the pituitary gland axis, and it controls the other glands. So this is adrenal, thyroid, pancreas, and the reproductive gonads. Major effects in endocrinology of COVID-19 which are studied are on the diabetes. So it's as if diabetes and COVID-19 are taken as in a sentence together always, because they have a very intimate connection and a very deadly connection, which we will go in detail today. The other hormone systems are not studied in detail, and just postulates which can be made what might be the causes or the effects of COVID-19 on these organ systems, and that those would be in short. But our major effect of COVID-19 is on diabetes. And like I said, it is a direct infection, but I feel direct infection of COVID is not much. It is like a little troublemaker. It just sets the motions and inflammatory cascades, and the immunity of our own body creates the havoc and the damage. So now we come to the major part of today's topic, COVID-19 and diabetes. Is it a catch-22 situation? So we know what is catch-22. Catch-22 is basically it is supposed to be a war which is never won. That is what is called as catch-22. But I, as an endocrinologist, feel that though it's not that bad, there are still hope. We should know how to deal with it, and it is very important that such kind of platforms are created where everybody comes together to deal with COVID-19. So what is the impact? So impact is two ways. How does the coronavirus impact a patient who is not a diabetic? And how does being a diabetic make you, whether it makes you more susceptible to coronavirus, or it makes you more it makes you more prone for the serious effects of the virus? We would like to see in the further slides. So this is a very nice cartoon which I found. So mortality means the death, the chances of dying because of COVID. So there is a distinct increase in the mortality. So type 1 diabetes is not that common. It is basically, as we say, an insulin dependent diabetes, generally comes in a younger age. And type 2 diabetes is a routine diabetes which we see in our society. The majority ones are type 2 diabetes. So here we see almost 2.5 to 3 times increase in the death. Chances of dying in because of COVID, if you are a diabetic, go up as high as 2 or 3 times. But again, there's a caveat in that. So if you are a diabetic which who is well controlled, so we see this ninja warrior here who is well controlled, fit, his blood glucose is under limits, and he is following his instructions of his endocrinologist very well, and he gets into COVID, his body is not allowing the COVID to enter. So here the survival is as good as the normal population. It's almost to the tune of 99%. So here it is, if you are a good controlled diabetic, you need not worry about COVID-19. Of course, I will tell you how to manage it at home if you are at home, or how to prevent getting COVID-19. But if you are a well controlled diabetic, the survival chances are definitely high. So, as a message, this is for all the diabetics that though you are under lockdown, you are at home, the diet and exercise is affected, you're unable to meet your doctor or unable to follow your daily practices, we need to find a way to have a well controlled blood glucose, because that directly tells us how much are the chances of survival. Here we find a patient who is poorly controlled, a diabetic who is not following his medications, who has a HbA1c. HbA1c is a very important concept in diabetes. It is a 3-month average sugar. If the HbA1c is around 6.5 or 7, that is considered as a good control. And if it is above, say, 8 or 9 or 10, is supposed to be poor control. So this is a patient who is not fit, who has problems of control. His sugars are all over the place, doesn't follow medications, maybe not able to have a follow up. And here he has COVID. The COVID has more power over him. And we can see the COVID is pushing this patient down the stairs. The stairs can be called as stairs of life, say. So this here, the mortality is to the tune of 11%. So this is the place which is those who are at high risk for death with COVID, patients with diabetics. So we may not call diabetes and COVID as a catch-22 situation or a situation with no hope. If you have a good control of diabetes, there is definitely chances of very good chances of survival. So even if you are a poorly controlled diabetic, what we can do now in this pandemic is ensure that all those who are poorly controlled or who do not know that they are diabetic be controlled properly, have access to experts, access to medications, access to proper diet and exercise. And this will definitely prevent the mortality of COVID in diabetics. So this kind of platform which we have, where we discuss nutrition, yoga, different experts coming and explaining the society about the different aspects of COVID in a very simple language, this will definitely help to prevent this kind of mortality which is happening today. So what are the reasons why there is so much fluctuation? So I find my patients who are perfectly well controlled and they get COVID and they are so worried about their sugars. They complain, doctor, the sugar is all over the place. I am doing my best. I don't understand what is happening over last so many years. I have been a very good patient. I've had good control. So there are certain reasons wherein they are not in the patient's hands. So the patient need not stress, need not have depression or anxiety thinking that they are doing something wrong because the sugars are fluctuating. So there are certain inherent problems with COVID which result in glucose fluctuation. So what are those? Right from the diet. So when we talk about diabetes, the majority of issues which happen are how is the lifestyle of the patient. So with lockdown, with people sitting at home, there is irregular diet. We all have noticed that. Reduced exercise, there is no place to exercise. If we live in smaller houses, we may not have the place to walk. It is very difficult to walk indoors. Then these irregular diets and irregular exercise habits further result in improper gastrointestinal absorption, which cause a fluctuating glucose. Then the other reason is stress. So much mental stress, reading about COVID, especially if they are diabetic, they are under double stress because everywhere it is mentioned that diabetes and COVID is it's like cancer. You are not going to survive. So they get under tremendous stress. When a person is under stress, they secrete a hormone called as a steroid hormone. In normal quantities, it is required to combat that stress, but in excess quantities, it causes all of the bad effects. So there will be glucose fluctuation, excessively high sugars, even if the patient is not having any sweets or having a proper diet because of stress. I have seen people developing diabetes because of stress. So this is again the mental stress happening because of this pandemic is the reason why so much problems are occurring in the diabetic control of the patient. In COVID, if you are having COVID, we generally use steroids in certain group of patients, especially those who are having oxygen requirement on the higher side. And the steroids given from outside, you might be knowing the names like dexamethasone, prednisolone. All these tablets will cause a very sharp increase in glucose. It's of course temporary till the time these steroids are given, but this is another reason because of which your glucose will fluctuate. Then because of the interruption in the routine visits to the doctor, problems of availability of medication, availability of strips of the glucometer will result in fluctuation in the glucose. And fear, anxiety, tension, this is a major part of this pandemic which is affecting every system of the body, and there need to be studies done for that, but I feel it has a very high proportion of morbidity and mortality is because of the anxiety and tension as compared to the COVID itself. So these are the reasons why there is fluctuation of glucose. So patients of diabetics need to understand that it is in their hands to follow the instructions, follow the diet, follow the exercise. But do not get stressed if the glucose is fluctuating too much. Be in contact with the doctor, understand why it is going high. Do not take stress because that ultimately results in further high glucose. So this is very important to know what are the reasons for glucose fluctuations in COVID-19 and diabetes. So, what are the clinical scenarios which I, as a diabetes specialist, have seen in this last few months during this COVID-19 pandemic? Again, I can't stress too much on the topic. If a stressful, anxious, and depressed patient will come, they will actually come in some in panic attacks sometimes to the hospital. Again, coming to the hospital itself will lead to another panic attack because of the COVID-19 pandemic. There is extreme insomnia either, or there is extreme sleepiness just to avoid getting up and reading about the COVID-19. There is a very much lack of exercise, but I have also found certain diabetics who have over exercised and gotten into trouble with injuries on the knee, injuries on the foot which are not healing. So again, too much of anything is bad. It has to be properly managed, controlled, and it should be under supervision of someone who is trained in those exercises. So now with gyms being closed down and physically not possible to attend the exercise classes, online classes, I feel the exercising which a diabetic does has to be done under supervision. You need to tell the trainer that you are a diabetic and you need to have proper fitting shoes, proper dietary and insulin regimens and medicines need to be adjusted with your doctor. So you should have proper fixed timings of the training. These are all very important. It's very easy to say, oh, I will exercise, but as a diabetic, you need to talk to your trainer and have like maybe a interview with all three, the doctor, the trainer, as well as the patient itself, and plan a proper exercise, because too much of exercise which is not supervised will result in major issues. Then again, food, either too much or too little. So again, I feel there should be a joint discussion of the dietitian, the doctor, as well as the patient. Everything can be done online these days. It's not very difficult. So when I do my teleconsultation, I actually give the contact number of my dietitian so that the patient feels at the end of the consultation that he has a holistic information and not just discussion about the medication. So these are what I have faced the clinical scenarios. There are certain scenarios where patients do not have access to medications because of the lockdown. So they stop their medications, land up with diabetic emergencies and get into the hospital where other patients are of COVID-19. So they get exposed to COVID-19 because of this. Then COVID-19 has taken precedence over other illnesses. So the routine emergencies of diabetics like diabetic foot problem, stroke or heart conditions are actually neglected, or not neglected, they are the patients feel it is too dangerous to go to the hospital sometimes, and they will sit at home. And we have heard that multiple mortality issues have occurred because they couldn't reach the hospital on time, or they chose to avoid going to the hospital. So that's why teleconsultation is very important, and knowing the red flags of your illness, so that even if there is COVID-19 in the hospital, to take proper precautions. The hospital has taken proper precautions to segregate as much as possible the COVID-19 from the other patients. You cannot ignore the red flags of stroke or say heart diseases. If you are a diabetic, you need to go to the hospital with adequate precautions. You may call the hospital in advance and tell them what you are facing, but uh, I will insist on all the diabetic patients to not ignore any kind of red flags which they would have otherwise not ignored if it wouldn't have been a pandemic situation. Majority issue of missing a routine visit has been taken care of with teleconsultation. Again, I know the kind of teleconsultation which needs internet or devices may not be available to most of the patients, but this, as a community, we should take care. We should try to build certain centers where these patients can go, of course with social distancing, and like an appointment basis where a technician can help them to connect to a healthcare professional, because not every patient will be well versed with the technical aspects of devices for the teleconsultation. And especially my diabetic patients are either in the sixth decade or the seventh decade of life, and they are not comfortable with these kind of devices. But that should not be the reason why as a community we cannot help them. It is not very difficult to have a small center with some technician manning it with one or two laptops and a camera. It should be done, and that will help in reaching out to more patients who are unable to visit the hospital and are unable to do the teleconsultation. Again, this what I stress: delayed visit to emergency care. That has been the biggest problem I feel, rather than the COVID-19 pandemic itself. More the mortality is happening is when there is a delay in visit to emergency care for illnesses other than COVID. So we need to remember that. So this is again a bit of a complicated flow chart, but it's basically the SARS-CoV-2 is COVID-19. So there is something called as beta cells. So beta cells are cells in the pancreas which secrete insulin. So this COVID-19 is supposed to damage these beta cells. So there are certain patients who are otherwise not diabetic but at higher risk, like if they are obese or if they have a family history of diabetes, then they get into very severe sugars at admission. I have seen many patients who say they were never diabetic, they had checked even recently, but when they get into COVID and are admitted, they are showing very high sugars. Then certain patients who are diabetic get into worsened metabolic control so bad that it results in a diabetic coma. Majority of these are older age group individuals. They also have other problems like kidney problem, hypertension, cardiovascular disorder. So if all these come together, what results is a poor outcome. I have seen certain patients who after COVID do not get back to normal sugars, and we call them as new onset diabetes, probably related to COVID. This will need further studies, but certain cases are such that they get pushed into diabetes and they never recover out of it. What would be as patients, what or as normal people, what we can do is you have a proper weight, have a control of your weight, have a control and have a good healthy lifestyle, and that is the key to preventing these kind of complications arising out of COVID. So how do we manage as doctors or as endocrinologists who treat diabetes? How do we manage it in COVID, or how different it is? This will be just some technical topics. I would like to I would try my best to speak in language which will be understood by everyone. So type 1 diabetic, they are always on insulin. There is no tablet for type 1 diabetic. So if you are a type 1 diabetic, you will be given insulin only. Whatever is your usual regimen, there might be some changes or there might be some increase in the units because of the fluctuations. If you are a type 2 diabetic or mild, say on those who are on diet or on medications, if you are in home quarantine, the sugars are okay, you will be managed as usual. You might not need insulin. For those who are sick, who are getting steroids, you will be given insulin treatment in the hospital, but most of you will recover when you go back, and you will be put on the normal oral tablets after you recover. Then there are certain class of patients who are not diabetic, but when they are given steroids, they get into high sugars. So these patients will again need insulin. So most of the COVID patients who go to the hospital are given insulin, but patients should remember that it is always going to be temporary. Once you are home and you are well, and your sugars start becoming better, there is a very high chance that you will be shifted back to tablets. So, as an appeal, as an endocrinologist to patients, is please do not get stressed, do not get worried. The insulin is only going to be for a short term. It is actually beneficial to be on insulin in the in sickness period, because it does not cause any side effects like gastrointestinal disturbances, which many of the diabetic pills will cause. So, do not get stressed. The doctor will try to shift you back to tablets if possible once you are better. So this is in short how we manage diabetes in COVID. It's as we manage the non-COVID patients. Only difference is the amount of insulin required is generally more when you are having COVID. There's something called as a sick day rule. This is for maybe the general practitioners who have logged in, that if your patients are on these medications, then if the patient is having COVID and he is sick, these medications need to be stopped immediately. Now, this is very important. We should have actually training sessions or such kind of webinars for the general physicians, because they are ultimately the backbone of the health system of our society. They are the ones, the family doctors, whom the patients will consult and believe. And if they are trained well, majority of our issues which we are facing today will get solved. So we should have such webinars where the general physicians are also trained about what are the different sick day rules for diabetic patients who develop COVID. So this would be helpful for them. If the patients are on tablets like SGLT2 inhibitors, they should be stopped. So this may not be useful for the general public, but it is definitely advisable to remember. Say if you are on a hypertensive tablet which is called as a diuretic, and you can actually ask your doctor, should I continue it or should I stop? So as a patient, you should know what your medications are, as in the names. You should always have a prescription handy. So whenever you meet any doctor who is not your diabetic doctor, but you should always disclose or tell him what medications you are taking. Have you made any changes in the dose? This is extremely important. Sometimes the doctor might miss out on asking, and it is the patient's. It would be better if the patient also on his own gives out the prescription, so that it makes the decision making easier. So this is important. Every patient should know what medications they are on. They may not know the details. If they have a prescription, even a photograph of the prescription, and if any changes are made, need to be told to the doctor who is treating COVID. This is extremely important. It avoids unnecessary adverse effects and unnecessary complications in the patient. So this is very important. What is called as a diabetic ketoacidosis. In layman's term, it is called as a diabetic coma. So too much sugar also causes coma, and too little sugar causes a hypoglycemic coma. So what are the red flags which a diabetic patient, say a diabetic patient is otherwise okay. He's been a diabetic for 20 years. He's on insulin and he is in home quarantine. He starts feeling these red flags. He should immediately check his sugars, and he should contact his diabetic doctor, or he should contact the emergency room for suspected ketoacidosis. So these are the red flags which should be told to all our diabetic patients: excessive thirst, too much urination, severe feeling of dehydration, shortness of breath. This shortness of breath can be because of COVID, but if patient is diabetic, we cannot say that, oh, it is because of COVID, it will settle down. He needs to check his sugar. If the sugars are above 300, above 500, the shortness of breath could be because of diabetic ketoacidosis. Starts getting leg cramp, unusual abdominal pain, multiple episodes of nausea, vomiting, mental confusion. Actually, mental confusion would be too late. These are the initial symptoms would be not feeling like before. That is what patients will say. I am not feeling good. I'm. It's more than what the COVID will do. There will be excessive thirst and urination. That won't be a part of usual COVID infection in non-diabetics. So this is very important to know. They should have a glucometer handy. Ketone strip in our country difficult to have at home, but ketones can be detected by the family members by a particular smell. It will be called as a fruity kind of odor. So these are the red flags. Actually, like a handout should be given to all diabetics who are in home quarantine for COVID. If in the hospital, definitely the medical personnel will take care, but the majority, 80% of the diabetics still are in home quarantine if they have COVID, because they are the milder variant. Only 5 to 10% would be in the hospital. These 80% should look at this red flags for diabetic coma. Now, what diabetics can do? I This is very important as COVID-19 diabetic patients. What you can do is do not miss your prescribed medications. If you have doubts whether to continue or not, please get in touch with your doctor and ask them upfront. Many of the patients are scared to ask. I tell my patients, please, it is your right to ask questions to the doctors. Of course, when you meet and in the timings prescribed, but as patients you should never keep things in your mind. You should always upfront ask your doctor, doctor, can I continue these medications? I am on this medications. If you're on any alternative therapies, like any other apart from allopathy therapies, you should tell the doctor. You don't be afraid that the doctor might not like what you are doing. It's okay, whatever you have done, you have to tell the doctor. And the doctors also should have empathy and listen out the patient. Do not make the patient scared. So please continue the prescribed medications. Any doubts needs to be cleared. Have a reserve of medications and glucose testing strips for up to 3 to 4 months. With the lockdown in remote places, it was not possible to order the medications and the testing strips. Though it is commendable how our country has gone online and tried to supply medications to even the remotest part of the country. But as a patient, it is better to have reserves always, because now we are more wiser after this lockdown that it can happen anytime, and we need to have at least 3 months of supplies. See, most of the expiry dates are for 1 to 2 years for the medication, and for the strips also up to 3 months. You can definitely store these strips at home in a proper way. So this is what diabetics should do. They should have a reserve of medications, and they should monitor blood glucose regularly. They should look at the red flag signs, and they should continue their medications. They should not fall prey to any myths or any WhatsApp messages or any social media messages circulating saying these medications need to be stopped. You read social media. I'm not saying don't read. You write down your doubts and you get it verified from people who are experts in the field or who have donated their life to studying this condition. It's not wrong. I always tell my patients, you google, you watch social media, you read, you discuss amongst yourselves, but always at the end of the day, before changing anything or before jumping onto any bandwagon of any therapies, please talk to me. I will listen out what you want to say, and we can discuss it in a proper way, so that you are well informed. It's very easy and it's very attractive to go behind therapies which are less painful, which are less costly for that matter, which do not involve any injections. Even I feel as a human I will get attracted to those therapies, but it is not advisable to do so. It's better you talk to your doctor. So very important is a two-way communication. Always establish a two-way communication with the person who is treating you. And it is definitely not considered bad manners to ask questions. It is actually good for your health in the long run to develop a habit of writing down your doubts and asking them before changing any therapy. Then healthy lifestyle. So we have had sessions about it, so it will be a short one slide from my side. So drink lot of water. Again, this kind of loose advice is difficult to give. You drink water if you have no other restrictions. If you are a diabetic patient with some kidney issues or cardiac issues, do not just blindly follow what everybody is saying and start drinking more water. You'll land up in trouble. So, if you are a healthy patient or a patient without any cardiac or kidney problems, of course, drink lots of water. If you are a renal patient or a kidney patient or a heart failure patient, wherein you were told to restrict water, please do not start drinking excess water. You speak to your doctor and ask them about whether, like everybody else, can I drink extra water. This is extremely important. Then comes healthy eating. Again, healthy eating is a very general terminology. Do not try to change too much what your diet has been prescribed. If you are a normal person or a diabetic without any other issues, you stick to your diabetic diet which has been told, and ensure that you eat lot of fresh fruits. To eat lot of fresh fruits and vegetables and freshly made food, rather than ordering stale food or ordering food from sources which we don't know. It's very important. If you are a patient who has kidney ailments, it is important to discuss with your nephrologist as to how much protein intake to be taken, how many multivitamins to be taken. This is a general terminology for people who do not have any illness, to eat healthy, take lots of multivitamins, lots of water. If you are having any renal or cardiac illnesses, it needs to be verified by your doctor. Similarly, working out. Sleeping well is very important. At least 8 hours of undisturbed sleep. I tell my patients, do not read any social media. Do not use your phone when you are in bed. Do not get alarmed by the news of COVID-19 pandemic. It is important to be informed, but definitely not good to be alarmed about it. Have sleep hygiene. Do not use your phone at least in a half an hour before you fall asleep. Do not keep it near your bed. Keep it away so that you are not tempted to read in the midnight or at 2 o'clock when you're unable to sleep. It's very important to sleep peacefully and have at least 8 hours of sleep. This is important from your mental health. It is actually also important from your physical health. The people who are not sleeping well have excess steroids in the system, which result in too much sugar fluctuations, poor immunity. So you're actually not helping your body or helping this pandemic by getting alarmed or getting anxious. Very important to sleep properly. Then teleconsultation. This is very important. Like we discussed previously, teleconsultation needs to be ensured for every diabetic patient in this country. How we do that? It is our responsibility as a community to help those who cannot handle devices. It cannot be like, oh, I don't know how to use a mobile. I don't know. I have nobody to help with the consultation. I do not have internet with me, that I won't be able to consult my doctor. At least telephonic consultation, if not by a device, has to be done. It depends on what your condition is, but it needs to be put forth to all the diabetics. They cannot miss their visits. Again, this is the same for all chronic conditions like hypertension, cardiac patients, any pregnant ladies with diabetes. Very important to have a teleconsultation. How we do it is as a community is the challenge with us. I feel we can have something like a artificial intelligence kind of assistance or some apps which can be designed, which can integrate the patient's SMBG is the sugar which he checks, what diet he's on, what activity he is doing, any other issues. So he will fill in from his side like a Google form, through either the mobile or through the net or even by post or email. Then there is a centralized AI assistants. I am very poor in all these concepts, but I might like the technical, our technical colleagues might be able to come out with something like this, like a centralized thing for the entire country or the city, wherein every patient, every diabetic patient has access to a specialist and is never alone in the fight for COVID and diabetes. So we have used artificial intelligence in having vegetables and fruits delivered to our home. Why not use it for diabetic care? So this pandemic has taught us that technology and medicine needs to go hand in hand. It cannot be two separate poles. So I feel this will help in integrating what we are trying to achieve by these webinars. This will help them in a day-to-day questions which they face, which is very difficult to get access to experts directly. So this will be like a log which the expert can log in and check what is happening with the patient and advise accordingly. We at Narayana Rudhyalaya have a system called as a remote monitoring system. We're trying to do almost like this. It's very in the infant stage, but it definitely helps the patients, and patients are relieved. It's a psychology of the patient. Oh, I have contact with my doctor. I am able to contact that feeling that my doctor is reachable gives immense relief and actually improves the sugars because the patient is stress free. So this is very important. If some technical people have joined and are listening, they might come up with something like this. What are the impact on other hormones? This would be a short slides. We can always go in detail in the next sessions on endocrinology. So we generally don't advise checking of other hormones when you are ill or when you are having any illness. Especially thyroid function tests should be avoided if possible if the patient is acutely ill. So it can cause a low TSH, it can cause some low hormonal levels of the thyroid, which are generally only lab related, and they get better once the patient improves. So we do not generally act on these levels. We ask the patient to repeat the thyroid test once they are well. There is certain report saying that
Hello, everyone. I believe there is uh, some issue at the expert's end. She was about to close the session, but then the internet connectivity has gone down. So I would request all the people who are watching us live at this moment at this Panacea platform to please visit our website for all the videos in the that we have recorded in the past. All the experts who have conducted the session online can visit our website www.panacea.eletsonline.com, and once again they can all the videos are properly systematically posted on our website. Everyone can visit the website and go through this session one by one as per their convenience. You can also ask questions if you have. If you want to get connected with the experts directly, we would be able to help you, and you just need to write to us or WhatsApp to us. You can find our contact details on the website, and also on the Facebook and other social media pages of Panacea program. So today we had conducted three sessions. The first session was with Mr. Sohini Roy Chaudhary. Then Mr. Dr. Shrikant from Narayana Health conducted a session on neurology, and just now we were listening to another experts on endocrinology from Narayana Health. So, with this, today we would like to end our session here. You may please visit our website again. And if you have any question, there is some part about 5 minutes of session has not been able to, will not be able to complete it due to internet connectivity. But we would be uploading the complete video on our website. So I request everyone to please again log into the website, visit the video, watch the video, and if you have any question, please ask us. So thank you so much. This is Harshal Desai from Panacea, part of editorial team at Elets Technomedia Private Limited. I once again thank you everyone. Please visit our website to understand the complete schedule of Panacea. As most of you are already aware, Panacea is a 6-month long campaign and we are every Sunday organizing several sessions by renowned experts from across the country, bringing them to you at your home. You can attend these sessions from the comfort of your home through your mobile or laptop or any other device. So once again, thank you everyone, and we would be meeting again as per our schedule for the next lineup of sessions. So thank you.